Good morning, everyone. Hope my voice is audible to all of you. And welcome to this holistic reversal of hypothyroidism masterclass today. So let's get started. So it is my usual practice to start any class with a short story. So let's get started with a short story. The story goes like this. There used to be a very young and enthusiastic scientist, and he is working on frogs. So frogs and how do they respond to commands and all. So this guy is actually measuring how far a frog can jump with certain commands. So what he did is like, he used to give a light electric shock as a cue and then used to say jump. So electric shock and jump and intensity, with intensity increasing, and he is measuring the jump of the frog. And after some time, what he did was like he removed one leg of the frog and gave the electric shock and asked the frog to jump. So compared to what it can, it is able to jump a lesser distance compared to its maximum. Then he removed second one, it jumped still less, and he removed the third one, and it is unable to jump that much. So finally, he removed all four legs and gave the electric shock and asked the frog to jump, and the frog is unable to move. The conclusion that he wrote on his notes is when you remove all the four legs of the frog becomes dumb, deaf. Sorry. So unfortunately, the scientific exploration or the scientific research that is happening, especially in healthcare and in medical care, especially in nutritional science and all, is somewhat related to this. Okay, so we need to have common sense along with scientific temper. That's what the purpose of the story is. Hope all of you got this. And coming to the presentation, and before I start my presentation, I would like to acknowledge few people. And first of all of you for taking out time on a working day, first hour in the morning, for attending. Second, I would like to thank my wife, who's a dietitian and has got more than 20 years of experience, and she's the one who taught me nutritional medicine. And last but not the least, the teachers at NEP Freedom Pass, Dr. Vishal and Teji, who helped me create these courses and helped me find my purpose. So some of you who don't know me, my name is Dr. Suresh. I started this organization called HNTP.online. HNTP stands for Holistic Nutrition Training Program. And before that, I worked in different capacities as medical officer, consultant. I worked with software companies, and basically my degree is MBBS. So unlike most of you, I'm not a qualified dietitian, but I'm a medical doctor. But for past 18 years, I have been practicing nutrition and nutrition. So what this class is not about. So the moment you see that, okay, there is a holistic approach or holistic reversal of hypothyroid, probably some of you might be thinking there must be a special diet plan or some new drugs or new interventions or certain kinds of recipes or quick fixes. So this class is not about any of them. So what is it about? So here we are looking at alternate and complementary theories of causation of hypothyroidism. How hypothyroid is coming about or expressed in a patient, and what is the holistic approach either to manage or in some cases reverse this. So before we go into, let's refresh our knowledge about thyroid, its function and what it does do. So we all know that thyroid is an endocrine gland. It secretes a hormone called thyroxine and it manages metabolism. Metabolism, as we know, consists of two components, catabolism and anabolism. Catabolism is breaking complex nutrients into smaller things or complex foods into nutrients. And anabolism is making whatever components we need in our body from those nutrients. So a simple estimate, every day in our body, more than 10 billion RBC are produced. Okay, more than 10 billion RBC. Billion is 100 crores. That means 1000 crore RBC are produced in a single day in our body. Look at the kind of metabolic activity that is happening inside our body. All this is regulated by our thyroid gland. So thyroid controls what? It controls vitamin metabolism, it controls weight, it controls all nutrients, plays a role in all nutrients metabolism. It is responsible for growth of an individual, cholesterol metabolism. Not only that, it's responsible for the functioning of heart. So either increased heart rate or low heart rate is directly controlled by thyroid. It controls respiration, skin and hair health, nervous system, sleep. Not only that, it is responsible for maintaining the blood volume, pressure, and even the digestive system. That means a healthy thyroid means a healthy metabolism, right? So now, what is hypothyroidism? We look at all the four aspects of hypothyroidism here. So what is the pathophysiology? What does hypothyroidism mean? Hypo is underactive, thyroid is thyroxine producing gland. Is that means it is a distinctive process or a system. So what is the clinical picture? Are clinical symptoms that we see in hypothyroidism? When it comes to skin and hair, it is increased sensitivity to cold and dry skin or thinning of hair. And when it comes to energy, so people who are having underperforming thyroid, they have a fatigue and they get easily tired. There is weight gain, puffy face, hoarseness. When it comes to muscles and joints, muscle weakness, muscle aches, tenderness, and stiffness. So all these things are because of underactive hypothyroidism. And other systems, when it comes to blood and heart, elevated cholesterol or slowed heart rate. Digestive system constipation is one of the main complication or symptom that we see in hypothyroidism. Reproductive system, normal, heavier than normal or irregular menstrual cycle. Both of them, they are connected. And nervous system, depression or irritability, impaired memory, difficulty concentrating. And we have seen cretins, right? In severe hypothyroidism, we see people suffering with this problem of cretinism. And what are the complications of hypothyroidism? So all these things are symptoms. So in some cases, when there is lack of enough iodine, it may lead to swelling of the gland, which we call as goiter. It may lead to certain heart conditions and mental health conditions. So people with very low hypothyroid, they have this idiotic syndrome. So mental health issues, neuropathy, mixed edema, that is like connective tissue disorder, infertility, birth defects, all of them are complications. Now, what are the causes, etiology? So there are so many causes that are that could lead to hypothyroidism. The most common thing we all know that Hashimoto's that we see nowadays very commonly is an autoimmune disease, and some of the hyperthyroidism patients, when they receive the treatment, it may underactivate the hypothyroid, and in some cases of goiter, when they remove thyroid, it may lead to hypothyroidism. And in some cancers, when thyroid is exposed to radiation, it may lead to, and certain medications also lead to hypothyroidism. Congenital disorders, there could be reasons of pituitary. In some people, thyroid is expressed, hypothyroidism is expressed only in pregnancy, and we all know that iodine deficiency leads to hypothyroidism, and which we saw most of the time in our SPM textbook, that sub-Himalayan area where the iodine was lacking, people are suffering with this hypothyroidism. So this clinical condition and all, we all know. Okay, this is not a big deal. So what is normal thyroid? When thyroid slows down, what is happening here in thyroid? What is thyroid failure? So the function of thyroid slows down, metabolism slows down, leads to certain symptoms and leads to a clinical picture, which we already discussed till now. And second thyroid failure symptom is biochemical picture. First thing is thyroxine levels fall and TSH level goes up. And another picture of hypothyroidism is, that means, what I mean by here thyroid failure is, if a patient comes to you You as a dietitian, patient comes to you, you see the clinical picture, biochemical picture, and pharmacotherapy. You will be seeing that, okay, the patient is given either L-Roxin or Thyronorm, micrograms of Thyroxin. So you have a therapeutic picture, biochemical picture, and clinical picture when it comes to this thyroid failure. Let's try to understand what is normal process of the function of thyroid. Thyroid, we know, produces thyroxine. It goes into the bloodstream, secreted directly into the bloodstream, and it goes to target cells. And the thyroxine hormone goes into the cell, and it activates the metabolic activity. So to understand more clearly, let us assume thyroid to be a power station, and the thyroxine is the lineman, and it is the colony of houses. Okay, the power is being produced here in thyroid. Thyroxine hormone is the lineman, electricity lineman, and the colony of the cells, the tissues in our body are like colony of cells. Now, for some reason, the target cells, the metabolism is not active. Metabolism is not active. For example, if a person is not doing any physical activity, what happens? What happens if a person is not being physically active? So the muscle cells, they don't have any work, so they don't require any food. That means they are not either catabolizing or metabolizing any kind of nutrients. So their work has come down. So having seen this, now the thyroxine levels. So it says to the power supply that, okay, nobody is living in these houses. We don't have to give any power. That means you don't require to produce as much thyroxine as you are producing, because these cells are not doing anything. So then what happens? The thyroid gland starts producing less hormone, but the this power plant is controlled by our government called pituitary. It looks into the levels of thyroxine in the blood. From the field, it will get a report sensing that why there are few people going and delivering electricity to the tissues. So it will not say anything to the cells and become active. What it will simply say is, it will send a memo to the power plant, that is thyroid gland. That memo is called TSH. Now, look at the story here. The thyroxine levels have come down. Pituitary sensed the low thyroxine levels and to increase the production of thyroxine. But thyroid gland knows, because it knows the ground reality, but the pituitary doesn't know whether the target cells or tissues are active or not. Okay, so what happens here is, this government or pituitary is concerned only about T3 and T4 levels, and it will pester, or it will start questioning thyroid and will send memo after memo. That is how TSH level will increase. So what is the conventional management? And if this is the pathophysiology or the clinical picture that you are presented with, and you have a patient coming to you as a dietitian, what is the conventional management of hypothyroidism here? So the conventional management of hypothyroidism is, first, the pharmacotherapy. So the patients, they go to a doctor, and doctor gives prescription, and if the doctor thinks that, okay, the patient also needs some nutrition therapy, then only the patient will come to you. I mean, I have never seen in 18 years of my experience a patient suffering with hypothyroidism coming directly to me for diet consultation. Either a doctor has to prescribe, or somebody said that, okay, by losing weight you can control your thyroid, then they will come. Unfortunately, that is the system that we are living in. So when the patient comes for medical nutrition therapy to you, so what do you do in medical nutrition therapy? You help the patient with weight loss, and by giving balanced diet. And when we say balanced diet, you avoid energy dense foods and refined carbohydrates. And we also suggest anti-inflammatory foods and plenty of antioxidant. We suggest exercise. So for example, go to gym or do aerobics, yoga, whatever it is. So now, what is being missed? If you do all these things, do you think that the patient is going to get reversed of his condition? Hypothyroidism. Yes or no? You are doing everything perfect, being a dietitian, okay, with the patient. So you are giving perfectly balanced diet, weight loss diet, anti-inflammatory, or cutting off energy dense foods and junk and all. Do you think that hypothyroidism can be reversed with that? Yes. Yes, Purnima, how do we do that? So why it's not helping sometimes and but not it doesn't? See here, when I say that something is missing, what do I mean by that? What do I mean by that something is missing? Is if a patient is on medication and medication is helping the patient to maintain their TSH level within normal limits or thyroxine or any other thing in normal levels. So that means we are managing the disease, but we are unable to reverse the disease. Okay. And many of you know that uh, many of you know that all these diseases are called all these diseases are called lifestyle diseases, and they're all preventable. So preventable in the sense, once you cross the line, is it difficult to reverse that condition? People used to think so till now, but not anymore. You don't have to. Uh, you don't have to live with the disease, whether it is diabetes or hypertension or high cholesterol or hypothyroidism for lifetime, even PCOS or infertility for lifetime. So there are certain approaches which help people reverse these conditions. Let's see what that approach is. Okay. Now, what is being missed? What is the extended role of a dietitian? How the extended role of a dietitian can actually help reverse this condition? So the first thing, whenever there is a symptoms and you go to a doctor and they elicit some signs and they ask the patient to go for certain tests, and the doctors will come up with some diagnosis and then the medical management. This is the role of a doctor, and the doctors are doing their job perfectly. There is nothing wrong with that. Okay. Now let us try to understand the role of a dietitian. So if a person is suffering with some signs and symptoms over here, there must be some imbalance in their blood biochemistry, right? There must be some imbalance in the blood biochemistry. So anything that is there in our blood is produced or not produced by a cell in our body. In this case, let us assume this cell to be the thyroid cell. Okay, the thyroid cell is supposed to secrete, the thyroid cell here is supposed to secrete the thyroxine hormone into the blood. It is not secreting. So there is a change in biochemistry of the blood. Why the cell is not secreting sufficient thyroxine over here? Because because the DNA, which is responsible for making all the proteins in our body, okay, all the proteins in our body is not producing. So why the DNA? Who is giving instructions to DNA whether to produce or not produce? Okay, who is doing that job? Who is giving that instruction? The food that we eat and the lifestyle of ours is actually controlling the way our DNA functions. DNA means DNA are nothing but protein factories. Okay, so the kind of food that we consume, it changes the biochemistry, and from here the information is going to the DNA, and in turn the DNA is either hyperactive or underactive to produce certain biochemical constituents in the blood. So ultimately, who is responsible for the functioning of our DNA? The person who is having the sickness is responsible, because the only uh, what do you say, the only instruction the DNA receives is from the blood biochemistry, and that blood biochemistry changes with our lifestyle and our food. That means just being a dietitian is not enough. You should be having a fair bit understanding of genomics, and you also should know how to manage a person's lifestyle. So if you combine all these three things, then you become a holistic coach. Okay, just the food alone is not effective. Let's see how this works. How do we understand about life? What is being a life coach? See, our patients and including ourselves, we all make choices day in and day out, right? So we make choices about our food, what breakfast, what is there in lunch, what is there for snacks and dinner and everything. We make choices each and every day. And we make choices about our exercise, our work, our social interactions, and our relationship. All these things, we make choices. And when we make these choices, how do we make these choices? To make a choice, there must be some kind of knowledge to make a choice about a particular food or exercise or work. And sometimes it is out of habit that we make these choices. Because my parents were eating like this, so I also eat the same way. It is coming from habit. Sometimes it is a learned behavior. What is learned behavior? You see in TV, suddenly you see Amitabh Bachchan and he comes with a chocolate and says that, okay, unless and otherwise you have a chocolate, your life is miserable. So that is a learned behavior, isn't it? And certain long-term memories. So you are used to like certain foods because of your childhood or because of your brought up. Say, for example, without roti and chawal, most of the Indians, they find it very difficult when they go out of country. Okay. So and belief systems. So certain belief systems are also responsible for the choices that we make day in and day out. So the person, what kind of choices he is making, if as a coach, if you are able to study, that gives a lot of clue to us. So let's say these are all organ systems. Let's say the first white circle is reproductive system, and this is like digestive system. This is cardiac system. This is circulatory system. So we have different organ systems in our body, and the brain controls or give commands to all these organ systems. And the way the brain does is uh, it will receive information about how a system is working. It gets a feedback, real-time feedback, and once it receives real-time feedback, brain has got certain uh, what do you say commanders. We call these triangles as endocrine glands. So brain will give instructions to these glands, and these glands in turn secrete the respective what do you say respective hormones. And these hormones, once the instructions are received from the brain, these endocrine glands will secrete hormones and they directly go to the organ system and they function. So here hormones are the last leg which is responsible for maintaining the bodily processes which we call as metabolism. So our metabolism is controlled totally by hormones, the final thing. So the feedback is going from these organ systems to the brain. Brain receives the feedback, and appropriately it will talk to either adrenal gland or thyroid gland or pancreas or whatever endocrine gland or testis or ovary, whatever it is. It will talk to them, and they in turn produce hormones, and they maintain the uh, metabolism. So brain is only giving command, but hormones are the people who are responsible for maintaining a person's metabolism. Now, so how our brain works? Brain works in two ways. There is a conscious mind, which we all are aware of, and there is subconscious mind. What is conscious mind? So you are watching a TV. There is just give me a second. Just give me a moment. ఎవరు కొట్టింది మీటింగ్ లో ఉన్నాం పండు. Right. Are you guys able to hear me now?
Yes, sir.
Yes, sir.
Sure. Thank you. So the conscious mind, we take certain decisions. For example, you're watching a TV, you know which channel to watch and which program to go after, and that is a conscious decision. Or you go to a restaurant, you order food, that is a conscious decision. But the moment you consume your food, okay, so you will not give instruction to your parietal cells in your stomach lining saying that, okay, produce this amount of acid. No, right? How much saliva to be produced and what hormones are to be produced and all these things, bile secretion, enzymes, intestinal motility, absorption, all these things are also being done in our body, but something in our brain is actually controlling that activity. It is called subconscious mind. Okay, it is also part of the brain, but it is not your conscious thing. See, it is an automated process. Now, this physiology, the whatever the bodily physiology that is happening uh, under the control of subconscious mind, okay, all the physiological processes are controlled by our subconscious mind. This is called programming. Say, for example, if I am a South Indian and I love rice, so if I keep eating rice over a period of time, what happens? My system is designed to process rice. Suddenly, if I started visiting north and staying there, and I am getting only paratha or like chapati, roti, something like that. So my system initially is not programmed to digest that food. But the good thing is our stomach lining, the gut lining, the turnover is only 72 hours. That means within 3 days, the entire lining will change. Based on the kind of food that is coming in, the system will change, it will adapt. And it is not, you are not aware of this. The subconscious mind is taking care of this. Okay. Now, how do we program? If we say that is programming, what is the language used by our brain to program certain things? So conscious mind, say for example, you like a certain kind of genre of movies or web series. So you know what to pick for. So it is the thoughts, brains, uh, that is how the conscious mind is programmed. But subconscious mind, what is the programming for subconscious mind? Subconscious mind, that means the entire body, the only way the body is programmed with the help of subconscious mind is emotions. If I say to my pancreas, okay, produce more insulin, that is a thought, that is information. The pancreas will not listen. Okay, but if I am feeling hungry, okay, if I am feeling hungry or if I am feeling satiated, accordingly, based on my emotions, the pancreas secretion will be altered. Okay, now the person is feeling so hungry, so he is going to eat a lot, it anticipates, and accordingly it secretes more insulin because more it is expecting more sugar. Similarly, when a person is angry, that is reflected by the function of our adrenal gland. So emotions is the language of the body, thoughts is the language of programming for our brain. Why is this important? Because whenever we experience an emotion, when we feel an emotion, it releases certain hormones. When you are happy, happy hormones are released. When you are sad or anxious, the stress hormones are released. And as I said earlier, the hormones are responsible for the metabolism. That means our physiology is dependent upon, the big gross physiology is dependent upon our emotions. Okay, so the feeling is releasing certain hormones, either happy or sad. Accordingly, the physiology changes. If you are happy, your physiology is happy. That is optimal. If you are sad or anxious, the physiology is down. Okay. Now, every action that we do, any activity, whether to go for a morning walk or not, whether to go for a holiday or not, whether to uh, declutter our house or dusting of our house or cooking something that you love, any action that you do is associated with an emotion and an action. And this action is triggered by a thought. Okay, everything that is there in our mind, and an action repeated over a period of time becomes a habit. If I ask you, who are you? What would you say? What would you say? I am a collection of habits. So if thought leads to an action, action leads to habit, and habit leads to a person, that means our thoughts control who we are. Okay, so a person is nothing but a sum total of the total thoughts, and a thought stored in our brain is called memory. Okay, we are nothing but our long term memory. So our emotions and our are scripting every moment of our life, and these emotions are based on our long term memory. See, if you recollect in the earlier slide, I told you about how people make choices. It all depends upon their education, their habits, long term memory. Okay, all these things. So now, if we understand this concept, we know we know that if a person is suffering with hypothyroidism, that means what? There must be some thoughts, there must be some emotions that are scripting his or her reality. If a person is happy and another person is sad, and both their height, weight, and age and everything is same, and we give the same kind of food to both of them, who will digest the food better? Obviously, the happy person. That means our emotions at any point of the time are controlling our metabolism. And if a person metabolism is not good enough, that means they're having negative emotions, or their emotions are not optimally healthy. So we know that with clinical approach, with whatever diet plan that we are giving and planning, it is not sufficient. And what is this holistic approach? With holistic approach, how we can do that? See, here we have our one of our senior coach, Ravati, and she has been with this holistic nutrition training program for more than a year now. And along with her, more than 200 of dietitians are getting trained. What they do, they apply this holistic approach and they help people. See, if a person is suffering with hypothyroidism for 14 years, all it takes for a coach, okay, is like 3 months or 4 months maximum, and they are able to bring it down. Not only in this patient, 36 years, 14 years of hypothyroidism. Since the age of 22, this girl is suffering with hypothyroidism, and not no doctors or I mean like specialists are able to help this patient. But with holistic approach, she is able to help, and like her, many of the holistic coaches are able to help them. How do they do it? Okay, so the holistic approach includes 5-step process. The first one is assessment, and assessing what are their thoughts, what are their emotions, what are they as a person. So there is an assessment. And delete what? There are certain behaviors, there are certain belief systems which are not serving you, so delete it. And formatting is like preparing the ground for what? Recreating healthy habits. So what are those healthy habits and how do we sustain? So this is the holistic approach. In the holistic approach, the first part, the assessment, we call this as the art of history taking, where all the coaches look into the 7 areas of life. What are the 7 areas of life that these holistic coaches study? So there is obviously the physical health. What is physical health? Height, weight, body mass index, body fat percentage, and lean body mass, water content, you name it. And also in the physical health comes their disease condition. For example, TSH, or their periods, or their sugar levels. All these things, they come under this physical health uh, area. Out of 7 areas, physical health covers everything, including the diet and all. And then comes the domestic health. What is domestic health? The relationship of the person in the family, either with parents or with siblings or with the spouse, everything, or with the kids, everything, we call this as domestic health. How healthy the person uh, in her or his domestic life. And second one is financial health. Financial health means like how comfortable they are and what kind of belief systems they hold when it comes to money matters, and how independent they are. And there is social health and how vocational health, job and profession. And we also look into psycho-emotional health, what kind of thoughts they harbor to, what kind of belief systems they have, and throughout the day, what is their emotional guidance system. All these things they study, and also their spiritual health. Right? Let me stop here. How many of you understood the 7 areas of life which I mentioned till now? If anybody didn't understand, please raise your hand.
As may I raise your hand option.
I'm sorry. Is it clear till now? Shall I go ahead, because we are left with only 7 minutes? Okay. Yeah. Thank you. So in holistic approach, we just don't limit ourselves to the kind of food, their anthropometry, their body composition, their eating habits, their 24-hour recall, and correcting the diet. So a person is not separate from all these aspects. And we as doctors or dietitians or other healthcare professionals are concerned only about the physical aspect of the individual. See, the physical aspect of an individual is decided by all these rest of the factors as well. So, in the art of history taking, usually the history taking for these holistic coaches usually ranges from 1 hour to 2 hours, and one of our coach actually the first history taking went on for 2 hours 50 minutes. Imagine a person talking to you for 2 hours 50 minutes just to give the history. Okay, so with that, what we try to understand is how they are faring in different areas of life. Say, for example, in this case, hypothyroidism, one of the areas for a patient, what could be the psycho-emotional or social profile? We look into these two aspects and how the person is feeling. Most of the thyroid patients that we have studied, okay, and their psychological behavior is they put others ahead of themselves. Okay, they give priority to others than giving priority to themselves. Now imagine when it comes to thyroid, or when it comes to gallstones, it is female, 40 and fat, the three most common risk factors for hypothyroidism. Right? So as a mother, by the time a woman turns 40, she is a mother and handling family and the in-laws and spouse and all the kids, because she's a female. And by the time 40, most of the people, they lose interest on their physical, health or their weight. And by the time they turn 40, their priorities change. They put others ahead of self. Either it is spouse priority, or it is the kids that is priority. And there is chronic sense of lack. So even if they are well educated and they are not able to do whatever they want to, there is sense of lack which leads to worklessness. They constantly feel unworthiness inside, and frequently they are put into a lot of shame. What are you doing? You are sitting all the time in the house, you are not doing anything. I am going out, I am earning, I am making all the decisions. And the kind of shame they experience over a period of time, whether it is emotional or physical shame or sexual abuse or whatever, they are put to a lot of shame. This could be one of the reasons, and unable to voice out. And most of the time, if you see people suffering with hypothyroidism, they are unable to speak out for themselves, right? And I specifically ask, if the female is coming for hypothyroid consultation and the husband is sitting next to her, I ask the husband to leave the consultation. Okay, because if the husband is there, she cannot speak whatever she wanted to. So most of the people with hypothyroidism, they are unable to voice out, and they don't have any kind of expression. Lack of expression is one of the psycho-emotional reason. And stifling with or swallowing words. Okay, whenever they want to speak something, the voice is not coming out smoothly, it is not free flowing. They look for words, and uh, most of the time they want to say something but they hold it back. So there is difficult in like expressing themselves. That's why, I mean, even if you look symbolically, Adam's apple, okay, when you're swallowing it moves up and down, right? So most of the people, they have problem with swallowing these words, and most of the people, they suffer with this humiliation. Of course it is very subtle, but nevertheless there is humiliation. They never get their say. That means what? Whatever their heart is feeling is not communicated to the brain, and brain is always looking outside with five senses. It is not focused on inside. So this is one of the most common psycho emotional cause, or social cause for hypothyroidism. Because if the person is like that, what happens? That means their metabolism is shunted. Okay, so they are not able to express themselves freely. They are not happy. When they are not happy, all the cells, they are feeling depressed. So that means their metabolic ability has come down. Okay, now once we do this, we identify areas to address in all 7 areas of life. And once we identify these areas, we use different tools. So we use tools called delete. As I said, there are five steps, right? The first one, artificial taking, is done. Second, we do delete, format, and recreate. In delete, we have acceptance and forgiveness. So how to accept the situation and how to forgive people who they are. And formatting, we do give them different kinds of breath work, and we explain the science behind that. Okay, some people say that, okay, yoga will heal hypothyroidism or PCOS. With yoga I change. So it is not the yoga, unless and otherwise. I mean, yoga helps, but unless and otherwise you as a coach understand the science behind it, or the pathophysiology behind the manifestation of the disease, you don't know which tool to use on whom. And once we prepare the ground by silencing or making the patient calm, and we use different types of creating new habits like affirmations, creative visualization. There are so many. I just gave a few examples over here. So once we do this, and there is a way, because in holistic nutrition we never give standalone consultations. We all take them in a 3 months program. Okay, because the change in eating habits is all about changing in eating pattern is all about changing their eating habits. Okay, you just cannot give a diet plan hypothyroidism and say that this is the diet plan. Then you are doing injustice to your profession and also to the patient, because it takes time. So it has to be a stepwise manner. So we start with not only eating changes in eating habits, in lifestyle, their thought process, and what are all the tools that they need to apply in order to change their mindset. So here we are recreating a new story. Whatever they have experienced till now, we are trying to create a new story. And in this NLP, that is neuro linguistic program technique, what we see is like we give them a new story to live up to. So that means they completely try to see the things in a different way. Because of paucity of time, and it is more than 100 hours of training in holistic nutrition, I cannot explain you in 30 minutes. But changing the story of the patient, whatever that is there, and what is the meaning of it, how to accept and how to forgive people who are responsible for her state, and let go and start. And how do they start the creative expression? So they need to go live a life without any kind of guilt or retribution. Retribution is vengeance or fear. Okay, what if I change? What will people think of me? Okay, I am now 40, mother of like two teenagers, and if I go out to a gym or start doing aerobics, what people think of me? So there should not be any kind of fear, or there should not be any kind of retribution. These people have ruined my career. They ruined my this thing. Uh, what do you say, dreams. So there should not be any kind of retribution. And also guilt. Okay, I studied this much and I spent this much of time, but I am unable to do because of my family responsibilities or my kids, because of other things. So there is no point in holding on to these things. So we try to help them uh, express in a more creative way. And the creative expression also means like giving attention to their own body and to their voice by what do you say, improve their communication skills. Communication skills need not be talking to the other person. Okay, if you are a painter and you love painting as in a childhood, okay, you can connect to that to create something that is, I mean, to express something that is more creative, innately creative inside. Or you can, one can start singing, one can start doing dancing or gardening or like do something. So where their vibration, the happy vibrations or the energy level of the patient improves. And as I said, there are certain formatting tools that we use, and there are different types of breathing techniques that we teach. One of them is like square breathing, exhalation, holding, inhalation, and holding. This is like conscious breathing. What happens in conscious breathing, especially in thyroid, is the more oxygen that we give in, the more number of mitochondria the cells produce. Because unless and otherwise there is enough oxygen in the blood circulation, the cells, there is no point in having holding on to more mitochondria. The number of mitochondria in cell is directly proportional to the metabolic health a person is having. And there are other some spiritual techniques. We advise them based on the person's um, openness to certain things. Say, for example, chanting certain mantras, and transcendental meditation is by Maharshi Mahesh Yogi. It was like popularized by him in US, and it is one of the uh, techniques that we use, but not the only technique. And we don't uh, advise this to all the people. Okay, say for example, if a person believes in the Christianity or in Islam, accordingly we'll give them something so that uh, there is some kind of meditative activity that is happening in the person. And also there are affirmations, and there is a huge science, and this itself is a huge chapter in our program, training program. We use all these things, okay, positive affirmations for the patient. So now we covered almost all the things. Okay, assessment, deleting, formatting, recreating, and finally following up. As I said, it is not one time consultation, it is a 3 months program. So for 3 months we are hand holding, that means to sustain those habits for those 3 months. So once we do all these things, this is what we achieve. Okay, as you have seen, and here is another one of our senior coach, Danya Irfan. She is from Hyderabad, and she helped a patient, and this patient is also suffering uh, with hypothyroidism for more than 14 years. Imagine 14 years you are going every 3 months or 6 months to an endocrinologist or a general medicine doctor, physician, and taking the same medication without any change in your life. But going to a holistic coach and studying the person as a whole, okay, studying the person as a whole and changing in which areas the patient is suffering from, and making those changes will help these people come out of this thing. So the moment 14 years of suffering is ended, I mean, look at the kind of impact that we have created for this patient. Okay, this is what we as holistic coaches can do, and that what we are doing at Holistic Nutrition Works. Okay, this is from my side. So before I conclude, what it takes to be a holistic nutritional coach and how your life is going to change as a holistic nutrition coach. So the first one is professional satisfaction. You'll get a lot of financial independence, control over personal time, work-life balance, respect from fellow professionals and family members. And you will come to know most important thing, that you can gain more by collaboration rather than competing with your fellow dietitians. Okay, so to be a holistic coach, I mean, that's what I teach all the students who join our program. You need three basic qualities. One is honest curiosity about the patient and non-judgmental towards your patient. Arey, ye to mota hai, bahut khata hoga. So that is a judgment. I mean, that comes automatically from our subconscious mind. And passion to create an impact. Imagine a person suffering with either PCOS or diabetes or hypothyroidism for so many years, and coming to you, their life totally changed. They're able to get back their life. Imagine the joy as a professional you experience once you are able to do this. This is what being a holistic nutrition coach is all about. So I thank you all for joining this program. With this, the academic session is over. Okay, and if people are interested to become those change makers, want to be holistic coaches, they can remain, and rest of the people, the academic session about like how holistic approach actually works is over. And those people who want to know about this holistic nutrition training program or want to learn more about holistic nutrition training program, they can stay back. I'll take another 2 minutes to explain about our program, so that those who are interested can explore our training program. And meanwhile, if you have any questions, I would like to answer. Sorry, I took 5 minutes more of your time. Sorry about that. Okay, shall I go ahead and explain the program to all of you? Anyone interested? How many of you are interested in knowing about our program, HNTP?
Yes,
You can just raise your hands so that
yes,
I'll
sir. You
come.
please go ahead.